I commanded you to like and subscribe, and you will do it. You will do it.
My daughter Todd wants you to be his friend. Please be my friend.
Disobedience will be severely punished.
What's going on, slavetards? Tonight, I want to talk about why I think the United States of America should nationalize their healthcare system. Why we should have nationalized healthcare system here in America. And why it's settled science, right? The rest of the world, they've already figured out that what's best for your citizens is to ensure they have access to care whenever they need it. And that they aren't going to die in the streets because they don't have the money. Right? So the rest of the world has already also figured out that it's cheaper, right? You don't have to pay all these middlemen and all these insurance companies and all this stuff, right? You pay the doctors and the providers well. You help fund their education, right? You pay them well, but you pay them directly, right? You pay them directly, right? These people that have, the countries that have universal health care, they also know how important it is to care about their people, right? So lots of these places have had pay for care before, and a lot of them have converted, right? We're the last holdout. We're the last holdout. And we're the last holdout because it's profitable and corporations fund our government, lobby our politicians, and it's profitable for them, right? They don't care about your health. The whole entire health insurance or the health industry in this country, right? It doesn't care about your health. Maybe in providers, but all the stuff that's stacked on top of it, like insurance and, all this stuff, it's not to keep costs down. It's not because they care about your health. It's just to suck on the sick like a succubus, like be a parasite on the sick and weak, right? I mean, for-profit healthcare, the idea of it is morbid, right? You can profit anything in this world. You can have free market capitalism on anything in this world you want to, right? I'm actually for it. Go for it. But you can't do that on people's health, right? You can't do that on sick people. You can't feed like a parasite on the sick. You can't do that, right? It shouldn't be allowed. In this country, that's all we care about. We care about the parasite, right? Our government and our politicians, the sellouts that represent us, they care about the parasite, right? They're sucking off the American people's blood as much as the insurance companies are, right? That's why it never changes in this country, right? It's not because of all the lies they've said in the past about how people in universal health care can't get care and are dying on the streets. Meanwhile, all the countries that have universal health care have a higher mortality rate than a lower mortality rate than America, whichever one it is. They're living longer, right? Just real quick, to take a look at what the life expectancies is of all these countries, you can look at the CIA.gov World Fact Book, Life Expectancy at Birth. And you can see Monaco, Singapore, Macau, Japan, Canada, Hong Kong, Iceland, San Marino, Switzerland. I mean, you just look at all these, Israel, South Korea, Spain, Italy, Sweden, all these countries, United Kingdom, Denmark, Portugal, all these countries above the United States of America, who's 49th in the world in mortality. Yeah, our healthcare systems is better than all these countries that I've been just rattled off that all have universal healthcare. America is literally the only wealthy industrialized nation that doesn't have healthcare for all citizens, that doesn't have cost-free healthcare, doesn't have universal healthcare. Like the only other countries that don't is like Nigeria, right? Cambodia and Chad, they don't even have insurance, just pay the provider directly. So I'm sure they're paying less than we do for healthcare. But we're the only ones. America's the only ones. And right now, our government's shut down because they don't want to give us an inch more than us having nothing. How come our mortality rate is dropping? Last time I checked, it was in the mid 40s or something. Yeah, it keeps dropping. And you might say, well, that's food. That's food. That's because we're all diabetic and fat and out of shape here in America. Well, first of all, that's another reason for nationalized healthcare is because in nationalized healthcare, they actually care about the health of the nation. Because if you look at all the nationalized healthcare countries, they don't allow lots of chemicals and bad ingredients that they've outlawed and banned, but is in every single thing here in the American food system, right? Like aspartame and, just there's endless amounts of stuff that we allow in our food system here that countries around the world won't even touch and allow their system to touch. And it's because most of those countries that won't allow their citizens to have this stuff that's poison to them in their food, they also have nationalized healthcare systems, right? But here, where we don't have a nationalized healthcare system, we profit off the sick, right? So we poison the food, right? We poison the food. And governments and politicians who are sucking off the blood of America, right, along with the insurance companies, they don't care about keeping you, healthy either because it's too profitable for the people that pay their salaries, right, and get them elected, right? That's our system. You can't tell me that that's the best system in the world, right? You can't tell me. And another argument that, they'll tell you all the time is like, rich people coming from, rich people, don't say that. People come from all over the world to access our first best in breed healthcare system here in America, right? And it's always the rich people. And say we have the best care in the entire world. I don't think we do, but say we have the best healthcare system in the entire world, right? What does it matter if you can't have access to it, if you can't afford it, if it's only for the ultra rich? What is this, the movie Elysium, right? You got to go off planet to, use some kind of special healing machine that only the rich can use. Like it's pretty morbid. It's morbid, right? Not only that, it's much, much cheaper to have a nationalized healthcare system. You negotiate as a nation instead of negotiating against a nation like the healthcare lobby and, the health insurance lobby and pharmaceutical companies. And you're negotiating on behalf of the nation, right? We want this diabetic drug and this is what we're going to pay for it. If you don't, you won't get our business and we'll go somewhere else or develop our own, right? We can fund the things that are ailing Americans. If it's, such and such disease or more people are dying of this cancer, we can put more, we can fund it directly without all this middle stuff, right? All this fat cheese, everybody getting rich off the sick, parasitic system that we have today, right? You start focusing on people's health and focusing on what ails America. Let's do some research in that area, right? And people say you got to wait longer for healthcare, in these places. So what? If you're critical, they take care of you. You're not waiting in these universal healthcare and critical, right? Most of the time, it may have been at first where cancer patients had to wait for their turn or whatever like that. But that's getting better in those countries, They take care of their people or they would be dying at a, younger age than Americans, and they aren't. They're not, right? I think the science is settled. On healthcare, you cannot profit off the sick just in principle. Just in principle. If that's the only argument that I have against a non-nationalized healthcare system is you cannot profit off the sick. Come on, people. Who here thinks profiting off the sick is a good idea, right? if for no other reason than that, I think we should, have nationalized healthcare system. It also promotes freedom. It also promotes entrepreneurship, right? How many people watching this video worry about getting sick and being able to afford if something bad happens to you? If you get sick, or if you get bit by a snake, or how many of you worry about the cost of that and what it would do to you financially? Nationalized healthcare system, you never think about that again, right? How many of you want to start your own business or go out on your own or work for yourself, but you can't afford the $30,000 a year it would cost, and another $20,000 worth of deductibles for you to insure your family? So trying to get a new business off the ground, a lot of them fail. With that added expense, it might be impossible, right? Not only do our healthcare systems profit off the weak, they stifle innovation. They stomp on the little guy, right? They keep people from starting their own business. They squash entrepreneurship. Do we really want that system? Is that the system we really want in America? And then you have the Republicans, who close the government down, and they call it a democratic shutdown because the Democrats want health care for Americans. Yet they have the Congress, they have the Senate and the House. They're in control. They only need 7 Democrats, and they won't negotiate at all because they don't care about your health or the American people, right? Do we want to continue in this system, or do we want to go to a cheaper, more efficient, and more, caring system and nationalize it? Peace.